JNC8 may have been quite late, but once it did arrive, it got a lot of attention. There's been some concern regarding, just exactly what kind of impact is it going to have on, these less aggressive recommendations on efforts to prevent cardiovascular disease. Now, there is an answer that's now available, at least some, in the December 2nd issue of the 2014 JACC. And I'm with Dr. William Borden, who is Associate Professor of Medicine at George Washington University. And we're talking about impact of the 2014 expert panel recommendations for management of high blood pressure on contemporary cardiovascular practice. And this is insights from NCDR PINNACLE. First, before we get into this, when the new guidelines came out, what was your response to them?
Yeah. Well, it was interesting leading up to the guidelines or the panel report, because they're not actually guidelines as endorsed by the American College of Cardiology, the American Heart Association. They are the panel that was appointed to be JNC8, and then it ended up that for different reasons, the JNC8 did not develop as planned, and this group went and published their recommendations in a peer-reviewed JAMA article. So when the recommendations came out, it was certainly a change, and my interest was how this was going to be taken up by practicing clinicians, and then ultimately how this was going to impact patient care.
So why did you do this study? Just to try to answer some of these questions that everybody's been asking?
Sure. I mean, I think that, as different recommendations come out about the management of various diseases, whether they be guidelines or other recommendations, I think that it's important for us to understand or trying to look at what the implications might be for our patients. And fortunately, with the PINNACLE registry, we have an opportunity with a real-world clinical data to perhaps get an early insight in what those changes might be ahead of actually seeing what the impact will be in real time.
So you've got a large database. You've got the NCDR PINNACLE registry. Mm-hmm. What were you looking at specifically? What questions were you asking?
So we were looking, using historical data, so 2008 through 2012, to say if the new panel recommendations were applied, how many patients would be meeting the goals compared to how many patients are meeting the goals with the current JNC7, and then who's that population for whom the goals change, and what are their characteristics, and what's their cardiovascular risk. So what we found was that amongst the PINNACLE population, which are outpatients managed in cardiology practices, that about 60% were meeting the JNC7 goals, and that increased to about 75% meeting the 2014 panel recommendations. And when we looked at that group, including the group for whom those recommendations changed, they had relatively high cardiovascular risk, both measured by 10-year Framingham score and 10-year atherosclerotic cardiovascular disease.
Now, on a nationwide scale, what does all this suggest?
Well, what it suggests is that we need to monitor very carefully as clinicians take up these recommendations from this panel. And the reason being because we've seen a steady decrease in stroke rates and improvements in cardiovascular morbidity and mortality over time, along with seeing an improvement in control of hypertension. So as this goes forward, I think we need to monitor what's happening with hypertension management and with cardiovascular morbidity and mortality to assure that those changes those improvements don't reverse.
Does your data show anything in terms of what we could do better?
Well, I think that we could do better in meeting guideline recommendations. So even with JNC7, there have been dramatic improvements. So from about 1990 to about 2008, the rates of control went up from about 25% to 50%, and what we saw was about 60% control. That being said, that means that there are 40% of patients who are not controlled. And so I think whatever recommendations or guidelines there are, I think it's important that we educate and try and improve adherence to evidence-based medicine.
Now, as you said, a minority of the JNC8 panel actually published their own minority report. So where do your results fit into the controversy that has built up around these recommendations?
Well, I think that we don't dive directly into that controversy. Our data does not provide any information directly to address that. We are providing additional information saying, in a real-world population, this is how it may play out. Or at least if these recommendations had come out in 2008, when our data set started for this study, this is how it would have played out in terms of patients and achieving goals. So I think what it says is that in this controversy, there was concern that was raised about what the real-world impacts would be and what is unknown about these improvements that we've seen in cardiovascular morbidity and mortality. And is there a risk that some of those improvements could reverse? And I think that our data shows that there is some concern about that, and I think that close monitoring will be necessary.
Yeah, that's what I was getting at, because that's not what you set out to do, but that particular finding does suggest that there could be some issues, that you really need to look at who you're treating and treat them to guidelines whenever you can, but get more patients on statins appears to be the issue, doesn't it?
Well, in this case, we're looking more at blood pressure management. So in terms of whether or not who we should be treating and to what degree, and certainly there have been many studies out there that have looked at blood pressure management, particularly in some of the populations for which the recommendations changed, people over the age of 60, diabetics, those with kidney disease. And I think that as we look at this, I think that we need to take into consideration that we've had these dramatic improvements, that how clinical practice in the real world plays out is sometimes different than in randomized controlled trials, and thinking about what the impacts will be on a population level scale. And so I think that applying these to real world populations gives some insights there.
And are you going to follow up and see how things are going maybe a year from now, 2 years from now?
Absolutely. And the PINNACLE registry provides a great opportunity to do that. Other groups have looked at this in other data sets, and so both our study group and others, I would encourage to look at this and all changes in guidelines to understand, again, in real-world populations, what the impact is so that we can calibrate and understand how to do this best for our patients.
This is the December 2nd issue of JACC, and it is Dr. William Borden, and we're looking at the impact of the 2014 expert panel recommendations for management of blood pressure. For CardioSource World News, I'm the executive editor, Rick McGuire.